Welcome to a podcast brought to you by the American Academy of Orthopedic Manual Physical Therapists. Our academy is a national organization committed to excellence in orthopedic manual physical therapy practice, education, and research, and we're here to explore a wide range of topics with you through interviews with content experts.
Hello, and welcome to the latest episode of the AOMT podcast. My name is Dr. Margaux Lojacono, physical therapist and fellow of the American Academy of Orthopedic Manual Physical Therapists. Today, I am joined by Dr. Laura Wenger. Laura is a physical therapist located in Durango, Colorado. After graduating from the University of Utah DPT program in 2013, she continued on with the University of Utah's orthopedic residency, which she completed in 2014. Laura has been treating patients and directs clinical education in an outpatient orthopedic private practice in Durango since 2014. She completed her OMPT fellowship through Bellin College in 2019 and graduated as a Doctor of Science in Physical Therapy through Bellin College in 2023. Laura began working in academia as an adjunct faculty member for musculoskeletal coursework at Baylor University's hybrid DPT program and transitioned to working for the University of Utah's DPT hybrid pathway in October 2022. She is now an assistant professor for the University of Utah's DPT hybrid pathway with teaching responsibilities including pathokinesiology, diagnostic imaging for PTs, and musculoskeletal management coursework, and continuing research focused on educational outcomes, especially in hybrid delivery of DPT education. Additionally, Laura continues to serve as an OMPT fellowship mentor in her clinic and has served on AOMP's Diversity Network Committee since 2022. Dr. Wenger, welcome to the program.
Thanks for having me.
Oh, you're welcome. I'm excited to talk to you about this. So we're here today with Dr. Wenger to talk about her manuscript that was published in the Physical Therapy Journal titled Evaluating and Characterizing the Scope of Care for Interventions Labeled as Manual Therapy in Low Back Pain Trials, a Scoping Review. So I think before we get started with talking about your manuscript, I think maybe a definition of what exactly a scoping review is and maybe the differences between a scoping review and a systematic review.
Yeah, and thanks for asking that, because that's definitely something that my research team and I, had to dig into and understand as we were taking on this project. And so the best way that I would describe it is that systematic reviews and scoping reviews are really asking two different kinds of questions. They're both going through this process where they're using like a rigorous, transparent method for really comprehensively trying to identify and analyze all of the research on a certain topic or to answer a certain question that they are being driven by. But ultimately, systematic reviews are really asking questions about specific interventions. So, for example, a systematic review might ask, what is the effectiveness of manual therapy as an intervention for patients with low back pain? And then a scoping review is looking more specifically at a topic about the literature, about the breadth of knowledge on a topic that we have so far. It's not necessarily guiding like clinical decision making. So an example of a question that might drive that is like what we used for our study. So what terminology is used to characterize interventions specifically labeled as manual therapy in clinical trials for treating low back pain, right? So we're still talking about the research at hand, but we're asking a question more about the actual research itself, not the utility or effectiveness of the types of interventions.
Okay, great. Thanks for clearing that up. So when we're talking about manual therapy, we'll get to what you found in your research in a little bit, but it seems like between different professions and even within physical therapy professions, there's some differing opinions of what actually defines manual therapy. So I'm going to read two different definitions of manual therapy to kind of frame it for the listeners as to kind of what we're talking about when we're talking about manual therapy as part of research. The Journal of Orthopedic and Sports Physical Therapy publishes clinical practice guidelines for physical therapists on a variety of topics. And in 2021, there was a revision to the low back pain clinical practice guidelines titled Interventions for the Management of Acute and Chronic Low Back Pain, Revision 2021. And so the authors of that guideline operationally defined manual and other directed therapies using the following categories: thrust or non-thrust mobilization, soft tissue mobilization, neural tissue mobilization, massage, dry needling, and traction. Conversely, IFOMT, which is the International Federation of Orthopedic Manual Physical Therapists, define orthopedic manual physical therapy as a specialized area of physiotherapy or physical therapy for the management of neuromusculoskeletal conditions based on clinical reasoning, using highly specific treatment approaches, including manual techniques and therapeutic exercises. OMPT also encompasses and is driven by the available scientific and clinical evidence and the biopsychosocial framework of each individual patient. So, even within two different physical therapy organizations, we have differing opinions of what encompasses manual therapy. Now, to be clear though, IFOMT is defining orthopedic manual physical therapy, which is in itself different from manual therapy as a more global term. So, just to kind of set the stage for the listeners, there's some differing opinions as what constitutes manual therapy. So, take us through your search strategy.
Yeah, and thank you for bringing up those definitions. And if I can add one more that, we found as we were trying to develop our search strategy and really kind of introduce this topic to our readers in our manuscript, the APTA also defines manual therapy as the synergistic application of movement-oriented strategies, integrating exercise and manually applied mobilization and manipulation procedures. So, yeah, another definition, and you can see, I think you're highlighting a really excellent point in that there is not a lot of clarity on what the term manual therapy actually means, right? And I think we need to be looking at it more as like an umbrella term. And that's going to be something, that we can talk about more as we get into the results here. But just to go back to your question about the search strategy, we really actually use the revised low back pain clinical practice guidelines to drive our search strategy. We had some excellent help from some librarians from two different universities who helped us really curate that search strategy to fit within 6 different databases that we looked at for this review so that we could really cast a wide net and bring in a lot of studies to look at for this.
So you started off with 8,000 studies. And what was your final number after exclusion?
Yeah, so out of those 8,000, we were able to do full text screenings for about 900, just under 900 studies, and ultimately ended up using our exclusion criteria to bring that down to 176 total studies that were included in our review.
What did you find in your results?
Yeah. So, after a big, thorough look between one of the other reviewers and myself, we kind of took the main chunk of reviewing and really extracting the data from those 176 randomized control trials that we found. We had studies from all over the world. So 6 continents were represented. We were looking at multiple professions. So not just physical therapy, although the majority of our studies ended up being from physical therapists providing the intervention. We did also look at, osteopathic, chiropractic, allopathic medicine, and just other different types of practitioners that were included. We weren't discriminatory about that. And really what we found after we combined duplicate terms, so, the crux of what we were looking at was what were the terms that these researchers used to define the manual therapy intervention that they provided as part of the randomized control trial. And we found that a total of 169 unique terms were used over this 176 studies. And the reason it's 169, it's not like every single study had something different or close to it. It's just that a lot of studies included multiple types of interventions, and they listed all of those out under their manual therapy intervention that they chose. And so ultimately, all of these terms emerged as what was used to being the intervention that was being described ultimately as manual therapy for these researchers.
So you had a lot of different manual therapy terms. How did you begin to categorize these into something that's more manageable?
Yeah, that was a task. We definitely went through an iterative process to figure that out, and ultimately what we came up with was trying to lump these terms into different categories based on the actual words that were used to describe the intervention. So, like a really great example is we ended up with a category called thrust. A lot of different terms used thrust in them. But they didn't always use thrust in combination with manipulation. Manipulation had its own separate category. So if we found terms that only had thrust in it, we made the decision not to infer based on like our professional knowledge and bias. We didn't want to automatically put that in a manipulation category because, we just wanted to see what were the actual terms that were used and to describe these interventions. And so we ultimately ended up with 18 different categories. So like counter strain, manipulation, mobilization, manual therapy was a category in itself. Some studies just chose to use that as their main describer. Mackenzie was a category that we found, muscle energy techniques, right? So all over the board, but things that different clinicians and different researchers across these studies chose to use as their intervention, all falling under the label of manual therapy.
And so you ended up with these categories, 18 categories. And as I was reading in your paper, you also used expert consultation in formulating these categories. Can you explain that?
Yeah, so in the world of scoping reviews, there have been some published frameworks to help guide what are the processes and what's the methodology of performing a well rounded scoping review. And so we looked at those and decided to follow those guidelines. And there's this sixth optional step that's kind of like the final step of a scoping review that we did choose to undertake. So it's basically called the expert consultation phase. And the whole goal of that is to take the product of whatever you found as part of answering your question for the scoping review and to consult stakeholders. So, in this case, clinicians, researchers, just basically asking them their thoughts about your findings in some way. And so, what we decided to do was basically we reached out to 15 researchers and clinicians that are, well known in the field of physical therapy, and we decided to reach out to them and basically say, this is what we found. Do you agree with how we categorized these using this iterative process that I described already? And we just got their opinion and their feedback on how we went through that categorization process. And it was really interesting because we ended up getting results from 11 of those experts that we reached out to. And first of all, everybody was like, wow, this is really interesting. We're really glad that you're doing this project because this just shows what a wide variety of things are being used to describe, quote, manual therapy in research. And then number two, most of them agreed with us with how we kind of just really went down to like, what are the actual words that were being used? There were a few who said, hey, why didn't you use professional inference, right, to categorize this? Because we all know that thrust is a manipulation technique, right? And so we just kind of took those results in and decided to keep our categorization the same since the majority of the experts did agree with the process that we undertook. But it did really add to this idea of, we maybe have a semantics issue going on when we are just throwing out the term manual therapy, because really, what does that actually mean when we use that term?
So I would agree. I think there is a bit of a semantics problem when we're talking about manual therapy in the realm of research. How would you say the challenges that you found in this scoping review relate to the reproducibility of research?
That's a really good question. There's so much excellent manual therapy related research being performed, and I have to be careful myself using the term manual therapy because again, it's just understanding like what does that actually mean? That's what I think this study is getting at the heart at, and these definitions that you mentioned earlier are really getting at the heart at. But at the end of the day, I think if we're providing techniques that fall under this umbrella term of manual therapy, which are many, I think it really calls for researchers to be specific about the actual terminology that they're using and, understanding what the intervention was. And, to go on further, there's some studies coming out talking more about like how that study was applied, right? So the frequency, the dosage, things like that, right? So that as consumers of research and people who are trying to apply what is coming out in this excellent research and these excellent randomized controlled trials and systematic reviews that are being produced to understand the effectiveness of different types of treatment for our patients, that we can better reproduce that, right? So that a clinician can walk up to a paper and read it, and they can say, oh, this specific type of intervention that falls under this large umbrella term of manual therapy is something that I know how to do. And look how effective it is for these patients that they used in the research. Or they could say, oh, I don't know how to do that, but maybe I should learn how to do that, right? But just really getting into the details of what those interventions are, I think will help researchers and clinicians be able to reproduce the excellent content that's coming out.
I think that's an excellent point. And when we think about that research pyramid with case studies and case series kind of at the bottom of that pyramid with cohort studies, randomized controlled trials, and eventually systematic reviews, and then meta analysis, the meta analysis and the systematic reviews rely on the research under that umbrella. And I think if, as researchers, we can do a better job of clarifying and being specific with what we're actually doing with our patients, I agree. I think that can only benefit clinicians and fellow researchers.
I just want to add on to that that I think we need to be really critical and curious as consumers and producers of research. So, for example, systematic reviews, right? There can be headlines and titles and abstracts of a systematic review that basically say, manual therapy is effective for treating low back pain, right? But when you dig into what those different articles that were included, what those different studies actually used for their interventions, they can be very different, right? And so they're trying to look at a treatment effect of umbrella term of an intervention when in actuality the treatments were not similar at all. Or right, it can be conversely where it can say manual therapy is not effective. And really when you dig into those articles, you're like, wow, multiple different things that were done here. So we're really not comparing apples to apples. And we need to be able to dig in more discreetly as consumers of the research to understand that.
Oh, for sure. Certain social media channels and influencers are stating that manual therapy isn't effective, but when we're looking at the research, exactly what was done, what was the dosing, and what were the specific treatments done. And I think that's an excellent point. Speaking to that, there was also another paper published in PTJ defining orthopedic manual therapy, and it was titled Orthopedic Manual Physical Therapy, A Modern Definition and Description. This manuscript came as the result of a task force from the American Academy of Orthopedic Manual Physical Therapists to create a more contemporary definition of OMPT. And I think this definition kind of ties into what we've been talking about integrating the active exercise that's targeted, the passive movements of the physical therapist, as well as the clinical reasoning that we as orthopedic manual therapists employ every day. And so the new updated definition that was published defines OMPT as a subspecialty of physical therapy featuring a systematic, active approach for the management of a broad spectrum of physical disorders. Based on a patient centered, advanced clinical reasoning model taught in fellowship training, OMPT has key distinguishing characteristics that include expertise in hands on, iterative examination and treatment strategies, inclusive of thrust and non thrust manipulation. Essential to OMPT is a focus on continuous reassessment through all aspects of care, synergistic application of carefully designed and dosed exercise, and a patient generated long term mindset driven by the available scientific and clinical evidence and the biopsychosocial framework of each individual patient. And I think this updated definition kind of really puts the patient at the center of it all, which I think is important and what we ultimately want to do as physical therapists. And the other thing that they touch on in this publication is that we know that in high quality RCTs and systematic reviews, that manual therapy and orthopedic manual therapy can be effective. And I think we need to maybe think more broadly about using OMPT in comparison to other modalities of treatment like medication and surgery. And that's what the authors suggest in this paper versus comparing one type of manual physical therapy to the other. But to your point, if the authors and the researchers aren't being clear in defining what it is that they're doing with their patients, I think that makes this kind of difficult.
Yeah. And, it was interesting in our scoping review, there were out of the 176 RCTs that we looked through, there were 17 that didn't even use any kind of descriptor beyond just saying that they performed manual therapy. Just given all of that, you can see the inherent issue and ability to interpret what does that actually mean when they're stopping at that really kind of overall umbrella term where there's so much intricacy. And not to discredit, like, running a really well done randomized controlled trial is really hard. And we all know that there are issues with trying to make research more pragmatic in nature so that we can really like take that information and run with it as clinicians, right? But if we are going to be going through the process and doing this hard work to really try to answer these important clinical questions, I think it's really to everybody's benefit the more specific that we can dial in and use the terminology from the get-go. I would even argue that manual therapy shouldn't be used in a title and abstract. I think they need to be more specific than that, given the results of our study. And then that just helps us put together all of these pieces so that we can be really effective and efficient OMPT practitioners.
I agree. And I think as educators, this is a great point that we can bring up with our students as they're moving through their graduate work and they're going to be employed soon. And, there is this big push for evidence informed practice and efficiency of treatment that we need to be choosing the best interventions for our patients. And if, as researchers, we can just be a little bit clearer as to what we're doing with our patients, I think that will go a long way.
Absolutely. I'm a pretty new educator in DPT education, but that's something that I'm working on integrating into my courses as much as possible, is just teaching all of these students who are going to be great professionals in our field how to more critically appraise the research, and understand the applicability of the research to their clinical practice. And at the end of the day, if we're not, as researchers or producers of research, if we're not giving enough information for people to be able to interpret those results better and understand the applicability of those results, we really need to bump up our ability to do that.
And I think that point is important not just for researchers, but for clinicians also. Would you agree?
Oh, yeah, absolutely. One thing that we brought up in the discussion of our paper is, you could walk into any clinic across the country right now, or even within the same city, even next door, and the clinicians are going to be describing what they're doing very differently. This brings it back in 2008, Mencken et al. Kind of had a call for a model of standardizing the manipulation terminology that we use in our PT practice, right? So, because one of the things that we found is there's so many terms, there are many, many terms that probably mean exactly the same thing. Like at the end of the day, if you were to ask those researchers to perform the intervention, they might be doing exactly the same thing, but they called it a wide variety of terms. And so, if we can even find a common language, not only in the research and being more specific in the research, but as clinicians, as educators, if we can really find a common language for how we're describing what we're doing, I think that's a really important thing that we can consider that would improve our effectiveness of understanding this data.
I agree, Laura. I think we've all been in the position of covering for a colleague and you've taken a look at their chart and you're really not quite sure of what they were doing with the patient, even though you may work with them every day and be familiar with the kinds of treatment that they're doing. I think that's an excellent point. So, once again, congratulations on your publication. This is a very interesting study, and I'm really glad that I got the chance to speak with you about it. So, what's next for you? Do you have any research projects in the pipeline?
Yeah, thanks. I'm glad we got to talk about it too. I like I said, I'm a pretty new educator in hybrid DPT specifically, and I have been working a lot behind the scenes to do some research to understand student success in hybrid DPT and looking at different like learning and study strategy tools, for example, that might predict success, as well as looking at some comparisons of the outcomes of students who are all taking DPT curriculum at the same time, but through different modes of learning. So through like hybrid versus remote, satellite versus a residential traditional learning kind of mode of delivery. And so that's something that I've been working on a lot. I really love to learn how people learn. So I'm just kind of digging into that and trying to understand how we can better provide opportunities for all of our DPT learners out there.
I think that's great. And it sounds like the subject of a future podcast. So I'll be looking forward to learning about the results that you found in this research, and maybe we can speak about it again in the future.
Absolutely.
Yeah. How can our listeners get a hold of you if they'd like to ask you questions or contact you?
Yeah, email is always the best way. So my email is published with our study in PTJ. It's laura.wenger@utah.edu. I am a sparing-ish user of social media these days, but I am also on Instagram at laurawenger.co. And I have a private account, but I have PT folks who reach out to me and ask to follow. I'm always happy to link up with them that way. And otherwise, conferences and out and about, hopefully I get to run into people as well.
That's great. So we'll have your contact info in the show notes, and then we'll also have the references for the papers that we've mentioned also for our listeners if they would like to learn more about this topic. I would like to once again thank Dr. Laura Wenger for joining me on this AMPT podcast episode. Thank you so much for joining me.
Thanks, Margaux.
This has been a production of the American Academy of Orthopedic Manual Physical Therapists. You can learn more about the Academy by visiting our website at aaompt.org. You can also find us on Facebook, Twitter, and Instagram by searching for our acronym, AAOMPT. The views and opinions expressed on the AOMPT podcast are those of the interviewers and interviewees and do not represent the official position of AOMPT. The information presented should not be used as personal healthcare or clinical practice advice. If you need to find an expert orthopedic physical therapist near you, then check out the Find a Fellow feature under the Public Resources tab at www.aaompt.org, which you can find in the show notes.